Alternatives to extraction really depends on exactly what's wrong with the tooth. The three big issues that we as veterinary dentists deal with. One is broken teeth. It's one of our most common problems, broken teeth. And so if we don't want to extract it, the most common way to fix that is with a root canal. So going inside the tooth, cleaning out the pulp that's been exposed, the nerve, and flushing it out with an antiseptic, and then putting a sealant in so that it seals the tooth from allowing bacteria from inside the mouth to get down into the bone. So that's our most common way to save teeth that have been damaged. It's not always possible. Sometimes a tooth is just so badly broken that we can't save it. But there are a lot of situations where we can. Other things that will be an alternative to extraction is if they have periodontal disease, for example. So periodontal disease is, perio means around the tooth, and dont is the tooth. And so that's a disease around the support structures of the tooth. When periodontal disease gets very bad, this is when the tooth gets loose, it gets mobile, and eventually falls out on its own. If we have less than 50% of the bone holding that tooth in place, then it's probably too late. Now, there's a few things that we can do. There are some periodontal surgeries, but most of the time, those really only work if we already have at least 50% of the bone supporting that tooth. But there's guided tissue regeneration that we can do to use bone grafts and membranes to help the bone regenerate, help the periodontal ligament regenerate around that tooth so that the support structure is stronger. There's periostic therapies that we can do. The most commonly used ones are doxyrobe, clindoral, Arestin, and these are antibiotic gels that go down around the tooth into a cleaned out pocket to help the gum reattach to those teeth. So those are some periodontal therapies that we can do. But periodontal disease is much harder to treat than endodontic disease. And then the other issue as a dentist that we deal with that we might want an alternative to extraction is braces. We have a lot of orthodontic problems that happen in dogs and cats. And we prefer not to do it just for cosmetics. When we're doing braces for dogs or cats, we're doing it because their teeth are in the wrong place. And when they close their mouth or bite down, it hurts or it does damage. Maybe their lower canines are pointed too close to the tongue, so they're straight up and down, they're poking into the roof of their mouth. Or maybe they've had a broken jaw, and when it healed, it didn't heal straight up and straight correctly, and so the teeth are in the wrong place. So we'll, instead of removing those teeth that are causing trauma, we can move them to a place where they no longer hurt.